What happened?
My dad just was painting and he fell off the ladder.
Okay, hang on. Go ahead and grab C-spine. We're going to roll the patient over to assess his airway. Okay, ready? We're going to move him on 3. 1, 2, 3. Okay. LaShawn, go ahead and get the ladder out of the way. I'm going to check the patient's airway. Look, listen, and feel. Okay. Patient is breathing, but he's having gurgling respirations. Go ahead and get the suction unit, get an OPA in, and control the patient's airway. Okay. Patient does have equal chest rise and is moving here adequately. Okay. Lung sounds are clear bilaterally. Pulse is present, rapid and strong. Okay. No obvious deformities noted. No obvious bleeding or trauma. Okay. Lane, grab me a baseline set of vital signs. Peripheral pulses are rapid and strong. At this point, I need to do my detailed trauma assessment. Beginning at the head, I'm going to check with the head, ears, eyes, nose, and throat. Starting with the head, there's no obvious trauma. Checking the eyes, I'm going to check the patient's pupils. Pupils are equal and reactive to light. I'm going to check the patient's ears for any blood or cerebrospinal fluid. The patient's ears are clear. No battle signs are noted on either side. Okay. The nose is clear, no discharge noted, no mouth discharge noted as well. Moving down to the neck, I'm going to check for tracheal deviation or any jugular vein distension. None are present. Moving on to the clavicles. No deformities present, no trauma noted. Clavicles are symmetrical, no subcutaneous emphysema noted. Moving on to the chest. Chest is symmetrical. Chest is moving symmetrically, no obvious trauma found. Moving on to the abdomen, I'm going to palpate the abdomen in all 4 quadrants. No rigidity noted, no obvious trauma noted. Checking the pelvis for symmetry. Symmetry is noted, no priapism found. Moving on to the patient's legs, checking for any obvious trauma. None is found. Checking the patient's left leg, no trauma is found. Moving on to the arms, beginning at the hands and working my way up. No trauma found. No trauma found to the patient's left arm as well. Okay. At this point, we need to control the patient's cervical spine. We have a backboard on the way. Go ahead and give us the collar. We'll apply the collar, Lane, if you would. We're going to log roll the patient in my direction after we apply the cervical spinal collar. Check the posterior, lay him down on the backboard, and prepare for transport. At this point, I'm going to check the patient's back for any trauma. No trauma noted. We can roll the patient onto the backboard.